All right. So, my dear doctors, as you see, we all have joined this session. So, I mean, this is the 2022. I mean, it's been my seventh year actually in teaching for AMC candidates, and I can tell proudly that I have, assisted almost um, so many candidates, and 774 uh, doctors actually have cleared already AMC exam, and probably in my knowledge, at least I know over 300 doctors, they are doing job in Australia. In recent time, if you follow the Sheriff's MC guideline group, uh, you have seen I sometimes post actually in the group, but we don't mention the name always, especially about the job, which hospital and the things. But hospital names we reveal, like which hospitals people, so that you get some idea that which hospital people are getting job and all these things actually. So please follow that group. Also, there is a hashtag Doctors Job Australia. If you click that one, you'll also get to see some of the previous posts, which because I think everyone's ultimate destination here is to get a job, right? So, so I want to ask in that way, like, how many of you actually here want to secure a job in next maybe 1 or 2 years actually. So please response in the comment section in that case. And I also please confirm me if you can see me and my sound is clear actually. I hope so that is clear, I think already. Great. So yeah. All right. So of course, so that's like, good little charge up. Like, when we start, of course, definitely, we all like, want to, clear everything. And um, start with this very common question, doctor. How much time I need for uh, getting a job? And in Australia, if I start preparation now, I'm a fresh graduate, I'm starting preparation. So what's my suggestion here? So the suggestion is here, yeah, that you start preparing for MC part 1, which usually takes like a 6 month, I would say, for a perfect preparation. Actually, if you go through our courses, things you'll find organized and all this thing. Um, in the new batches, what we're going to introduce actually, the first ever in MC. I mean, we used to teach theory, recall, mock, um, question bank we have. So everything, things are fine. A new thing we are introducing this batch, I would say, would be very lucky that there would be, you know, uh, notes, especially specific notes on AMC actually. So which, after like, 1 2 weeks we'll distribute. We still, it's under construction. So a new notes and the thing fresh, especially those I tell in the classes, not like a typical orthodox notes, like a copy from a book or things like that. Very orthodox things, very much with a bullet point that will be very much useful for many of you. Alongside with the classes, you can also study them, because I always like, when I was student, I always used to also like notes and the thing. But don't forget one thing, that you also need to go through a book, John Murtak, which usually on the Sundays, I will teach you actually, like especially Sunday classes, I will teach mostly from the John Murtak. Today, I'm not going to teach you from John Murtak. Today we'll do a like a short ECG class, just to, because so that the other time we can communicate. So this is important. So normally, and you can find so many of my YouTube videos where already uh, how I'm using John Murtag and the thing, and many people also follow that pattern of teaching of mine. So that's like a very useful, to be honest, actually, because John Murtag, you need to study now. You also need it, the concept for part 2, and also for your practice. So if it is left over, yeah, so that's the thing. So if I already have notes, why it is necessary, I'm teaching from John Murtag. It's for your future, my dear doctors, actually. So otherwise, you'll be left over. I can tell you one thing uh, very proudly, like those candidates start doing job, they sometimes thank me back that, doctor, you teach us the John Murtag in nice way, and my supervisor is very happy that, I know in which part of the John Murtag, what managements are there. So the same things is also there in Australia, like in the rounds and the things, they do ask questions actually. And if you can give some references, this was always good. Okay, so please keep that in mind. This is a very good practice, like knowing the John Mutta. From John Mutta, a lot of things are repeated in the exam, but please do keep it in mind. A lot of things does not also come from John Mutta actually. So for that, we'll guide you and tell you there are notes, but also we'll guide you from which books and what to study. So let's go and forward, moving forward a bit more. Let me turn off myself. All right. You can see a lot of things are animated in my classes actually. There is also some new changes, so welcome to, yeah, so my class, my name is Dr. Sharir, so I myself have cleared it, of course, and of course, I've been teaching these things for last 7 years. And so far, this is a good number. I think you all will agree. I mean, 774 is not a bad number, I think. And also success rate is over 90%, 93% in MC part one, it's like, going through. So best wishes to you guys. Like same, I will expect maybe 100% this time. Yeah. I mean, this couple of months, they're 100% too, actually. So I wish all of you, will have 100% passing, definitely, So we call it Amin, like, so in our, like, in religion, it's okay. A few things about few class things, my dear doctors, like few things, be respectful to each other and things. So um, please, my humble request. I know you all are busy, but you are going to Australia. It's counted as a bit a difficult exam, probably a bit difficult than also PLAB exam because I'm a trainer of PLAB as well. So I know the differences very well, actually. So AMC is more harder in terms of the syllabus, to be honest, like compared to PLAB. But about PLAB, it is also getting harder with time. By 2024, it will be similar like AMC, equal difficult when it will be turned to UKML. Maybe you heard this term. Anyway, so weekly attending live classes is very, very important because I can tell you one thing that when you are attending the live classes, like you have to be here for 3 hours and you have to take notes and you have to finish it. But if you just keep watching the recording, like, it cannot be finished in 3 hours. It sometimes takes 24 hours. Okay, so this is one of the important thing. Focus on the live classes, try to discuss with your friends. Don't depend on the recording all the time. Actually, it will just stretch your MC journey. I'm telling you again, just depending on the recording, you'll stretch your MC journey. And if you no way can't attend the live classes, we have courses like Netflix and Amazon Prime, where you take the course and you keep attending at your own pace, actually. So we also have courses like that, just like plug and play, actually, and just keep playing video, keep checking notes, actually. So we also have courses. So those of you who are for sure that you cannot attend live in any way, then it's better to switch to, we call it course to your Netflix type course, actually. All right. So use laptop, not iPad and phone during the classes. See, I can figure out normally when I enter into classes, how many of you are attending, I mean, using mobile devices. I mean, I got some notification on that one. So I can see among this 150, they're like, almost 33 or 34 people are using tab mobile type of devices, actually, which I hope so from next classes, except for emergency, you try not to use it, actually. I mean, you can use it, but it's better try not to, actually, because see, watching a cinema in a small screen, watching a cinema in large screen is different. It will create more impact. Okay, so it will create more impact, right? So that's more important for us. Yes, so that was some of the class related things, and I hope so that's setting in your mind. Finish the topic weekly, very, very important. Say in the beginning, I'll start with GIT, we'll see. So my suggestion would be finish everything related to GIT in the 1 week. So every week that is going, don't keep the work and everything for next week, actually. Trust me, your everything will be hampered. Even if it takes like a whole day study later, somehow you missed few things in that week because of some personal issues. We all have personal issues, right? But at least then make a weekend and you go thoroughly with your study partner. Now the second word is coming, study partner. So finish things per week. Secondly, you need a study partner, actually. Definitely you can also approach people in the group. We make a, I think, statement for this when who is looking for a study partner. So you can see your time zone and the thing, and you can choose a study partner actually. Trust me. So 2 or 3 people together is a good study group normally. Yeah. Also four can be if dedicated people out there actually. But if you make a WhatsApp group of 10 people, it's not maybe a very good idea, except for at the end you can do it actually. Like, when you almost about to finish course, then quickly solving some recalls, then these WhatsApp groups of large people. But it's better to do discussion in the Sharia's MC guideline group. I'll tell you why in that certain point actually. Okay, like not now. Secondly, mandatory participation during class. I can see there's a very smart batch and they are participating very nicely so far, whatever things are going through. And of course, we post class recordings usually I try to post in 24 hours. Some cases, if I have personal reason, there can be 48 hours it may take, or say a national holiday or something like that, or I'm taking a day off. So kindly, don't inboxing me about that recording thing. We got a little annoyed by that because eventually we're going to post it. Yes. And before class, do not let me know I'm going to miss a class. See, we are very genuine teachers. I've been in teaching field for 8, 9 years. I think it's my ninth year in teaching, I think. Yeah. So, no teacher likes that, going to miss a class. Yes, of course, if very emergency issue, parents is sick, you have to kid is suddenly become sick, you have to rush them to the hospital, that's a different thing. I have a duty, sir, I'm going to miss the class. Now this is not expected and this is not also accepted. So better you don't text me regarding that actually, because we are also human. The mood got spoiled before the class if you text like I'm not going to attend the class, because I have to come sit here for 2.5 hours or 3 hours. So I also expect you to also sit in the same way. Okay. So let's do it together. I mean, let's go for the journey together. That will be nice for all of you actually. So work smarter, work harder. That's like for next 5, 6 months. I'm pretty sure you'll be in the destination. Now let's go with the few things like, what are the new changes in the MC as a participating in the group. I want to know, do you want to know the new changes, or you already know about the new changes in MC? Please comment in the comment section. If you are watching in YouTube, you can also comment there that, if you want to know like, new changes, or if any specific inquiries, later we'll see that in YouTube actually. So I'll post this particular segment in YouTube. You can also ask there like some of the inquiries. I'm also very responsive in my YouTube channel, which name as a Sharia Ahmed Shooter. All right. So definitely everyone wants to know, yes, some of the changes. All right. Now, previously, I post a video and I think that's the highest viewed um, YouTube video, one of that's like in most people, get to know about AMC by seeing that video, AMC frequently asked question by Dr. Shariar. Have you seen that video by any chance actually? Because a lot of outsiders are also attending the session, but there is a very common video actually on that one that, yeah. So otherwise, you can just go to your YouTube and please type now. I mean, you can watch it later that, AMC frequently asked question. Please type it now. Actually, later you can watch it. So you can just open it actually. So very, very important. But we ask people in the group to watch it because otherwise you may have some problem in understanding few things actually. All right. So that is a mandatory actually. Also, see, well done. Someone watched it yesterday. That's perfect. So everything in the brain actually. Okay. So some few changes from that format I told actually. That's like a masterpiece video, we call it. So what are the new changes? Yeah, that let's go and see in that one. So this is looking interesting to us. Uh, Before I start, like, it's looking a little crazy by this time. So let's go and with a better format actually. All right, this looks good. I think please let me know. This looks more easier than the so previous one is a hand drawing. This is like a more yeah, that sticky notes actually. I'll guide you guys more about a sticky note in coming days. Normally, you should have also sticky notes like this. It's available in the shops actually. You can buy it And you should also have a board. Someday especially during cardiology, I'll guide you guys how to use a sticky notes, and that actually how changes your life. Okay, very, very important actually. All right, great. So let's go and see a few things. I turned off myself. Now, a few things, some new changes in AMC. Before new changes in AMC, let me tell you a few things about that AMC exam in next 5 minutes, some basics regarding the exam. Okay, so forget about these titles. Those are the controversial or you probably need to know, but now I'm going to tell you about the basic regarding the AMC. All right, so some of the basic regarding the AMC, which I'm going to tell you now is, um, first of all, it is a two-part exam actually, AMC part 1. I hope you are writing few things actually, or maybe I can write in the side. Alongside actually. So maybe it will be easy for some of you. Now, parts of the exam I'm talking about. So that is like a two-part of an AMC1 and AMC2. I hope this is everyone knows AMC1 and AMC2. Now, few things people don't know, there are more other options available. Okay, before going to the option, let's talk about the pathways. Like which pathway you are choosing. Do you know which pathway you are going to follow? I mean, let's just see, because some of them maybe already did their verification and the thing, or you can go to the AMC portal and you can open, you can type AMC portal account and it will take you to the account. Actually, you need to create account actually, AMC portal account and the Epic verification. There's two things. We'll talk about this thing some other day. Now, the pathway you are following mostly is called, standard pathway. So that means there are other type of pathways also available. So one is this is standard pathway. Another is a specialist pathway. And another is a competent pathway. All right. So competent pathway, you guys don't need because you guys have planned and chosen for AMC. So this is you guys are here. This is standard pathway. So whenever you do the registration or form fill up, you choose standard pathway. Okay, that's the thing. So there's an option if you are a specialist or super specialist, maybe you have a lot of experience, maybe you have UK or Ireland training as well. In that case, you can consider becoming a specialist, or maybe some of your senior or teacher or consultant may also ask you, okay, since you're preparing for AMC, can you tell anything about this specialist pathway? Now, if you go to my YouTube channel, there is already a very nice video is given regarding the specialist pathway. By the way, let me tell you, in my YouTube, there's like a 200 videos available, regarding AMC thing. I'm the first one, introduced so many YouTube videos regarding the AMC actually. So specialist pathway relevant, there is a video already exist. You can go and check that one as well. If someone is a specialist, or you can give it to your professor or someone if ask you actually, right? So because my YouTube channel is more like a guidance actually. So these are the pathway thing. And these are the AMC1 and AMC2. Now, few of the old, not say alternative, other ways. Now, some people, what they do after AMC1, they go to GP route. Now, I want to ask you, how many of you want to have a more 9 to 5 job in future, like a typical 9 to 5? You don't want to deal much emergencies. You mostly want to refer patients. Yeah, so you want to have a good life with your partner, kids, and things like that. But if you're very enthusiastic, you want to go to medicine, you want to go to surgery, then that situation is little, different. So I think we all want 9 to 5. In our country, it's very hard to get a 9 to 5 job, because after 9 to 5, again, the chamber started. Or if you're in a hospital, you'll get called someday, you are on call or things like that. So sometimes 2 nights, 2 days, sometimes too early morning. So make our routine very bad, to be honest. Okay, so that's the thing. Great. So we'll go gradually step by step. We have 5 months to discuss so many things. So I know like more questions are coming. So just follow the class for now. Actually, in future, we'll also arrange session with our candidates. And yeah, so not every jobs are not 9 to 5. If you're a medical officer job, that's not a 9 to 5. That's like a shifting duties, morning, evening, nights, and on call actually 24 hour. Some cases 48 hours as well. I saw. Okay, so after MC1, there's a GP route, and you can only take that one by an exam called PESCI. As I said, I'm not going in very details about some other things like what is PESCI and things. Okay, PESCI is for the GP. I mean, those want to go to the GP after MC1, they can get a job offer. Now, this is one of the things some people ask. Some people make fun. Haha, it's a wrong statement. Some people portray that after MC1 job exists. You see, come on, like in after MC1, the GP job you have to apply after MC1. Okay, so that's the funny thing. So after MC1, you have to apply for job for the GP. What is the criteria of getting a job as a GP and all this thing? Those part separately, I will guide you guys at certain time. But for now, just remember, if you have more experience, approximately like 5 years, I would say 4 or 5 years, then you can think about going to GP. If you're a fresh graduate, just drop that idea for now. Okay, you are not eligible even for the GP. Okay. So, but you can do it later after doing medical officer job and things. Later, you can convert to GP. That's a different thing. But initially, don't have experience much. Don't think about GP. Think about medical officer. Think about emergency medical officer, internal medicine, psychiatry, gynae, this kind of things. Next, another thing after AMC1, I have a whole video on that one. You can go to the WBA route. It is called workplace-based assessment. You can see, I mean, one of the candidate I was talking who is already in the WBS system. So she's telling, I know things more, but I asked her, like, to explain the situation. So you can type workplace-based assessment, and you can type my name, Shahriar Ahmed. You will find that YouTube video. I hope you are taking notes. Those you want to see later, you can go to. So you can type workplace-based assessment. You type my name, Shahriar. YouTube will take you to that video directly. Okay, so these are some of the routes. Are we clear? How many routes we have? Normally, the very basic standard MC1, MC2. Other routes like with MC1 going to the GP, with MC1 going to WBA. Of course, after MC1, you go to MC2. MC2. And most people follow this one. After MC1, most people go to the AMC2. That's very standard and that's very basic actually. You finish MC1, you finish MC2. It's better actually, to be honest, I would say. See, there's like always 75%, 80% female doctor joined. And also in medical field, number of female doctors. I mean, female empowerment is increasing. So probably in medical field and whatever can be the reason, I don't know why female are more in the medical field. Anyways, I think more secure job, maybe society also accept it more. Now, thing is that everyone is equal, but see a few things, because male cannot give childbirth and things like that, of course, due to certain reason. So the reason is actually like every female, especially, especially family process and few things, there's a time period actually that can get sometime hampered at certain points. So it is ideal, like, you, especially for the female, I mean, for everyone I'm telling, but please consider, because many are fresh graduate, because many I talk this year, and when I talk to them after 2 years, they become a mother by this time. Okay, so thing is here that, if you give a gap after your MC1, that may not be a very good news for you. So you give a gap in MC1, you may have a kid, which is a very normal thing. Now you forget the MC1 knowledge is actually, there's a very clear thing. It is written, your MC1 knowledge will be reflected in your MC2. Now, if you give a very break, like a 1.5 year, 2 year, it might be, a little bit, you step down, some cases we have seen lost moral and all this thing. hormonal lot of changes happen during pregnancy and the thing. So this is important, guys. Uh, it's very, very important that you finish MC1, MC2, you try to get a job offer and the thing. All right. So that's very, very important. You try to get a job offer, you try to get a general registration. Now I'm going to tell you what is general registration is actually. Okay. So that our next part that is coming, as I said, today I'm telling everything more superficially. In next 5 months, I'll tell you everything in more details. Don't worry. I'm more expert on that one. That's why I'm also quite popular for not only for classes, but explaining things. I'm well, actually. I'm very clear cut about, the steps and things like that. All right. And don't worry, you don't have to ask because this is my approach to explaining things. Don't worry. We are back. Can you hear me, guys? I'm sorry about that. Okay, testing microphone. Yeah, no worries. We are talking about, a few things like general registration. Let me take you to there actually. Okay. Screen visible. Let me please confirm me one more time. Can you see my screen? All good. So we finished up to the some of the things like parts of AMC, some of the other ways of AMC like GP, WBA, and then AMC2. And after that, we are going through the general registration. Up to this, everyone, understood? I hope so. Yes. Superficially, yes. Yeah, not as a deep. Now, as I said, what should be your plan? Your plan should be, general registration. So for general registration, here is a thing um, that is called, you know, in order to get that one, you need MC1, MC2, and 1 year working. Clear, everyone? Like a full registration doctor, like MC1, MC2, and 1 year working in Australia. And there is some rotation. It has to be like pediatrics this week, medicine this week, blah, blah. There's a lot of criteria. You don't need to know now all those things. All right. So these are a few of the additional things which uh, probably would be useful for many of you. All right. So in order to get general registration, MC1, MC2, and at the same time, 1 year of working. Now, why general registration is important? Now, here is this important part that is coming in order to get PR. Now, this is my next question. Who wants to get the citizenship in Australia? That's a very basic question. Maybe some of you already have it. So who wants to get a citizenship there actually? Yeah. Okay. As I said, we'll talk about more about general registration and the frequent question answering. I'm not going today. So this is the way of getting general registration. Um, General registration you can also get from the WBS system as well. Okay, that's one more thing. General registration you can also get from the WBS system actually. So, but that's not a very easy way always. The WBS system and also getting the general. So the best way to get general registration is actually MC1, MC2, and all these things actually. So that's why I usually say you all should be focused. You all should be focused. Yes. WBA means workplace based assessment actually. Okay. As I said, forget about that one. About WBA, I already told that, you can go to my YouTube channel. Please keep checking the video. When you enter in YouTube, please use a laptop, don't use mobile. Then click the video section. There's a lot of subtitles are given. At the end of the class, I will also show you that, there's some how to check like, YouTube channel and find a lot of videos. Okay, don't worry. Great. So this is the thing. So this is the PR is the destination. Now, this is few rules, regulation, registration part, and the thing, the PR part. So now you also get up to the question superficially, how to secure a PR in Australia. So general registration is the clearest way, and it's also like, probably a bit easier way for doctors to secure the PR actually, because it's quite high rated, the PR thing. Now, how to get a PR, there are also technical things that immigration lawyer can tell you more actually, how to get point from a state, how to get point from a NATI exam, blah, blah, there's a lot of things. That immigration, that's not my department. So please, my humble request, never ask me question regarding PR process. I'm not an immigration lawyer, first of all. That is immigration lawyers can tell you. But the basic one, we can tell you that general registration you need. Yes. Even you go to a lawyer, they'll tell, please finish your AMC and get your registration. Yeah, they will also tell you the same things. Okay. So up to this, I hope you get an idea and all these things. Yes. All right. Okay. 1 year of work experience means 1 year of working in Australia. After working in Australia, not like you have a experience in your home country. With the experience in your home country, you probably get the job. Okay, so and usually it is recommended to have like 2 years of experience from the home country in order to get a job in Australia. When you apply for job, like think in that way. When you are applying for a job, there are other candidates also applying. If the other candidate has experience in their CV, you will not be taken actually for that experience. So many, especially after their marriage, they go to Australia or move to Australia so quickly and they left over their CV. Remember one thing, you have to come back again for getting this experience. Okay, there is no way that you can, unless you have a hospital director is your maybe father-in-law or something like that. Yeah, or something. But still, you have to go through interview and things, and their processes are very crystal clear most cases. Okay, so make sure you have some experience before you leave the country. That's my opinion. And there's another thing, some people text me, they try to bargain to themselves actually. I don't have experience any other way. I said no other way available. I mean, if you get extremely, extremely lucky, that can be like a 1%. They have very high connection in Australia. Maybe, you know, uh, city councillor, maybe your relative or something like that. Or, the process, minister or something like, hospital director helps you, so those are some different processes. Yes. Yeah. All right. So let's come back after going through this. For more, I recommend you to go to my YouTube channel rather than inboxing me. Um, have a write to my YouTube channel, because all these things have been answered properly, including how to secure a job. Now that's a total different video, how to secure a job in Australia, that I'm not going to discuss today here actually. Well, I think in the middle of the course, actually, usually I discuss when you guys become a little bit more mature by watching some of my videos, actually, then it's better to discuss that time. All right. Great. So now here is a thing. Let's go and see how it goes, actually. Let me check one time. Is sound and videos are clear to all of you before going to the next segment? Is sound and video is clear? All good? As I said, so many candidates, it's the opening day, so I cannot really follow the chat box actually. So many messages. Great. As I said, there's a YouTube channel. You can go and drop your inquiries. There's a video you'll find, AMC frequently asked question. You go there, you drop your comment. I'll be answering you back in 24 hours. Okay. So that's the best way. All right. Okay. Go to my YouTube, type AMC frequently asked question, open that video, ask your inquiries. I'll get back to you in 24 hours. All right. Next, coming to new format changes and some AMC related things actually. First of all, do you know that AMC exam is related to 150 mark questions? Do you know this? The 150 question you have to answer overall. All right. And you have to finish it in 2 to 5 minutes. Hope you know this. This to basic information. 150 questions and 2 to 5. All good. So after that, there is a distribution like this. Now, this distribution was given in AMC handbook actually previously. Now, if you count them, it comes around 120. Now, where is this 30 question goes? This 30 question is actually related to pilot. Now, previously, pilot question or trial question used to come with a 0 mark question. Nowadays, any pilot question exists or not? So let's see how many of you know about this. Is pilot question anymore exist in MC exam? The answer is a, so pilot question nowadays, no pilot question, no pilot question. So every 150 question you will be marked. Now they didn't upload any new mark distribution. I repeat, they didn't update any new mark distribution because this mark distribution, which was given in MC handbook, by the way, is a 12 years old book. So they are following that format. Now it is 150. My observation personally is they have increased in certain areas the marks and the questions. Where, example, in psychiatry, they started asking more questions than ever before. So I would say, like, in case of psychiatry, you can see 15, maybe you can count as a 25. Just my observation as an expert, actually. Next is a topic like it is written population health. Now, what is population health? This means epidemiology, biostat, screening or preventive medicine, all right, and ethics. So it's altogether, it's like a 15. We feel also question are increasing here. Clear? That means more ethical question, more preventive type of question, more travel medicine type of question. Like those are like a preventive type of thing. Last but not the least, if you can see that, also pediatric, psychiatry, and everywhere maybe little 2-3 rise of questions. So is it done, guys? Understood everyone how to distribute this 150 question? Previously given 120, but my personal observation nowadays, psychiatry question increased, population health, that is ethical question, and bit biostat and relevant question that has been increased. And every segment, maybe this 35 make it 38, 25 make it 28, like I need maybe make it 18 or things like that. That's how actually. Also, we have a list of videos that you must have to see before going to the exam. Okay, so that is the thing. There's like a special 15 videos which will introduce you later, which you must have to see before going to the exam. Example, I'll give you a few clues like ECG, fundoscopy, radiology, anthropometry, okay, driving. There are like a 15 topics, very important, relevant, which I will introduce at certain part of the course. Must revise them because from those 15 videos, you are expecting almost 32 to 35 question. That makes sense. Very much makes sense actually. Okay. So I will guide you, like, especially tip tricks. You'll also find some folder which I will guide you guys in future, like, what are some tip tricks for the exam. With all this, the next question that comes, are there any negative markings? Are there any negative marking? The answer is a big no. There is no negative marking. Compare contrast, example, PLAB exam, that also does not have negative markings. Actually, most of the exams nowadays does not have any negative markings. Just doing little compare contrast with other exams. Okay. Now there is an option in the real screen. Like example, when I went to my exam, there was an option for flag, like here in the top of the screen. And I can click that one. If I click that flag, I can review the marked question later. Now, my next question is, that thing exists now, or yes or no? What do you think? Is flagging helpful or not? Because I can flag it and I can pass to the next question. I can flag it and pass to the next question. Is this helpful technically? Yes, it was helpful, to be honest, because you can finish your exam first, and those you don't know, review later. Now you have to have a perfect finishing. Okay, and you will not get chance to come back. Now this is the new change. Okay, can't come back. Previously, after finishing the exam, they give you a list of 150 questions, and you can see which places have flags. Okay, so this is the thing. So if there is a distribution table like this, so previously, it's like a 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So maybe you'll see a flag option near to the 8. The 8 number you were confused, you flagged. Now you click that one, you directly enter into the flag question, then click it and come back. Now, no point of discussing this because there is no flag option. Is flag option? Is exists? No. Now there is a thing called distribution of the mark. What do you mean by this distribution of the mark? Like, so your result will be announced when you'll receive a result. You will see if you receive 250 out of 500, that is a pass. Let me tell you the top marks. That's of course from our academy. That was actually 300. Exact mark actually we should not reveal, but it is above 380. Okay, scored by one of my candidate in 2018. So it was 380 was the mark. It was as I said, it is back in 300, 2018. After that, this kind of mark is quite insane. And that particular time, a lot doctor from our academy used to score 350. So I can tell at least, I think 40 candidates name, they scored 350, from the academy. Nowadays, getting 320 is even difficult because they have made a lot of changes in the exam. Okay. Nowadays, if you get a 320, I would say it's almost similar like 350. Right. So because of the changing pattern of the question, the flag option taken away, and the distribution of the marking and all this thing, the summary is they have made it a bit more harder. That's why the mark thing has changed, actually, in my opinion, actually, because I also get to know and touch with the candidates. They also let me know. I'm also sure, like, when you receive a mark, you'll also let me know that I receive marks like this. So nowadays, people are getting like 290, 300, 305, 310. This is how I see a lot of my candidates. I mean, those are kind of like toppers. Clear about the mark distribution? Okay, now this brings us to one thing. You have to answer 150 question and why the total mark is 500. That means each question carries 1 mark or each question carries more marks. What do you think? A single question is carrying 1 mark or more marks because you're getting result out of 500. So answer for that one is individual question carries more marks. It can be 3, it can be 4, it can be 5. We don't know that one. Answer is we don't know that one. Which question carries what type of mark? We don't know that one. If you get 249, is that a pass or fail in AMC exam? If you get 249, is that a pass or fail in the MC exam? It's a fail. And I have seen also, paper like this just for 1 mark. You know what why I'm telling this actually? Because it feels so bad. Okay, so there are histories, so many, like they're like a 774 pass, like, but there are also few histories of fail. Like if you see 93%, that means out of 100, if 100 is going, that maybe 6 or 7 is also failing. Nowadays, actually, previously it was more high. Back in 2018, passing rate was 97, 98% actually. Dropped down because not because of academy, but certainly mark distribution, a lot of things they have made a lot harder. Previously, a lot of recall used to come in the exam. People just do like a 6-8 months recall and like a quick recipe, and many used to pass exam actually. I know a lot of histories and things, but nowadays, you have to take a very proper preparation and then go to the exam, right? So make sure, you take some time and prepare well. Previously, I've seen people passing even 2-3 months. Do some recalls, has good concept, nail the exam actually. Anyways, great. So 225 is the minute. Each question carries, I think, probably more than 1 mark. I hope that's clear. All right, so these are few format related changes, which I think would be useful for many of you, and few exam related tips. Now I'll give you superficial. So many you will find in the YouTube. So many I'm going to tell you during the whole 5 months. So, I mean, every class there will be some tips for in the initial 5 minutes. All right. Okay, someone asked if 6 months is enough to pass the exam. Yes. I mean, it can be 6 months or 7 months actually. For safety, it's 7 months. Many are passing exam in 7 months. See, we take like a 5 month to finish. So some people give a 1 month revision, some people give a 2 month revision, some people give a 3 month revision. Now that depends on how you prepare with the course actually. As I said, if you don't miss classes, if you finish the topic in time, then later you can directly go for a 1 month revision. But during whole 5 months, if you miss few things, then again it takes like a 1 month to recover that particular things, then again go for a final revision. So you understand that it's definitely possible to pass in 6 months, but that also depends on your performance in that. So very regular doctors, they definitely can go in 6 months. Now if we're starting in this August and we're finishing by mid of January, some of you can sit in February exam or March exam actually. If I would have been in your position, I would have picked up March actually. I mean, it will give me a little bit more time for revision. Okay, that's my opinion actually in that case actually. Rather than going in February, just almost like a month. So I think I would be preferring like March actually. It will give me a little bit more time for revision actually. Don't forget, last but not the least, the exam fees. The exam fees is pretty high. So exam fees, do you know the exam fees? So it's like I think this is the fees for MC1 right now, AUD. Now, let's see some doctors what they do. We don't know about next year unless if it changes. After converting, can you tell me how much it is in US dollars? Because some people might get a false information uh, checking this one. So this is like a AUD, Australian dollar. Okay, so how much it comes in US dollar, because we understand US dollar. All right. So please double check it, like in US dollar or in pounds. Yeah. Okay. Someone mentioned, okay, it's like approximately 2000 USD. I mean, are you telling, or you can also Google it actually? Someone, I mean, that's right. You will learn a new thing actually. Now, normally what I do, uh, go to Google and type, AUD to USD normally. Then they give a box, and I just put that, you know, this number 2750, and they quickly convert it actually. So this is also new thing you learn actually. If you're going to abroad, sometime you need to go to money exchange, and you have to do it. So you should know it actually, how to exchange actually. Anyways, that comes approximately. Yeah, so see, someone just already quickly did it. 1900 from 40. So 1900. Yes, that US dollar. Everyone clear now? Everyone clear now? All good. So since it's an expensive exam, please make sure you give a sure shot. You should be a sure shot for the exam before going to. So we'll guide you. There will be weekly mocks and the things. There will be also large mock at the end. So you'll get time to assess yourself with lot of mocks. Yeah. All right, actually. Yes. I mean, technically you think in that way, you spend more, you earn more. Student doctor, they earn, you know, much more, like, so I can tell you roughly the salary of a Australian doctor. So from level 2 to level 3, level 2 to level 3 level. Level 1 means like interns, but intern they don't take from abroad normally. So level 2 to level 3, it's like this is minimum 80,000 to 1 lakh. The numbers are correct. Yes. So this is advertised. I have seen in many in general actually. Okay, so if you have some more experience, you can earn this amount. If you don't have much experience, you might be in the beginner, and maybe the first job, it might be a startup. Yeah, but often I have seen many getting like this. Yeah, per annum year. Now you can understand how what's the amount actually. You can convert now. Yeah, that's in dollar actually. I'm telling AUD. That's like a annual income. Yes, like a 80,000 roughly. The minimum is 80,000 Australian dollar. That's the minimum actually. Okay, but and up to this level, if you have more experience, you can earn up to this level. Yeah, clear, guys. Lot of things we discussed, I think. Yeah, forget about level 1. We're not going into level 1. It's like, medical officer. You are going for level 2. Medical officers are level 2, level 2 or level 3, depends on your experience. Okay. So that's the thing. Exam tips and following classes, I would say study sincerely in these 5-6 months. There's a very common thing your senior must tell you: don't overthink. Whatever Dr. Sharier says, just follow them. Okay, so so follow my instructions. Follow my instruction. Things comes with also experience actually. So 5-6 months dedicatedly study, follow instruction. We'll provide you soft copy of all books, but make sure you also buy John Murtak 8th edition hard copy. Optional, you can also buy MC handbook hard copy, psychiatry Kaplan hard copy. Yeah. We'll also provide you question bank and relevant things, so don't worry about that one. Of course, there's some time after medicine finishing, or by the end of medicine, we'll give you question bank or introduce you to the question banks. All right. Oh, one important thing. Yes, someone asked a nice question. Is this exam is computer based? Yes, it is a computer adaptive exam. And one more information is everyone exam question is same on the exam day. Answer is a no. That's the difference with the MRCP and PLAB exams. Actually, every individual person's exam, the person sit near to you attending an exam in the computer is get a different question from you. Okay, so they have very big bank, central bank. Yes. All right. Recommended to buy John Murtak 8th edition actually for future and futuristic. If you think because it's just beginning. So there'll be MC1, there will be MC2. That's like a investment. So this is only one important investment you can do. And if you don't find John Murtagh 8th edition in your country, that's a different thing. It is available in Bangladesh. It is available in India. In India, check it in Amazon. It is available also in Pakistan. I saw some doctors also mentioning that it is available in the Pakistani shops. If anyone knows which shops in Pakistan, you can also write here. Actually, in India, it's Amazon. In Bangladesh, it's Nilkhet area, the book market area. It's available actually. Yes. All right. Okay. Any editions of I only my concern is John Murtagh 8th edition. Other I don't have any concern. Handbook has this same old edition. Kaplan any edition is fine. Doesn't matter. Okay. So only my concern is John Murtagh 8th edition. That's the thing. Get a hard copy. Because 8th edition, we don't have a hard copy yet in that way. Um, Proper hard copy takes little time to come up and things like that. So better, I mean, no matter soft copy, you still, I'd recommend you to buy a hard copy. This is, very, very important. Okay, someone said Winco bookstore in Pakistan. Okay, thank you. So you can go and check that one. So start the process. I mean, there's a word. If you want something and if you want to pay, you can get anything, right? Actually, like you can buy anything actually, as long as you want to pay. So you can search around and yeah, you'll find it eventually. Great. No worries. So these are in general. I hope so. This is useful for some of you. So far, so good. And all the best and best wishes. As I said, like there's a whole 5 months to guide you guys on that actually, like, what books and the thing, not in one class, we cannot go in that details actually. But I believe if you go to my YouTube channel, is already suggestions, books, and everything is given. Okay, so I'll just take my screen for a second and give you a tour of my YouTube channel. That might give you a little bit more idea that what to search and what not to search. So I'll give you a few quick tips here. All right, I take my screen, sharing the screen again. Now this is my YouTube channel. I'm not sure if you have subscribed or not. Okay. We're starting the course on the 14th of August, actually. All right. Thank you for asking this. I'm going to start our course on the 14th of August, actually. Now, so can you see my screen, my dear doctors? Yeah. Registration last date is 20th August, but it is first come first. Before that, even we usually offer 100 type of seats for new doctors. If it's gone, it's gone. Actually, it's like that. So it's better we hurry. Let us finish the chat box for a while. Let's focus here now because it's a little difficult for me to focus, like, because it's a first class. So many outsiders are joining. So it's a little difficult to focus. Important information. We are starting on the 14th. I mean, officially, that's given in the routine I posted already in our group. And secondly, last date of admission is 20th. If you have any issues like by 20th to finish admission, like, okay, I'm getting my salary by end of month or something, in that case, you can inbox us actually. So we can reserve your seat, by your verbal word. That's not a problem. Okay. Now, this is the YouTube channel and the thing, which I was mentioning. Some of the popular uploads. Now, popular uploads, you see, are you eligible for exam? Now, you should also check that one. Are you really eligible for Student Medical Council exam? Is your medical college is verified? For that one, you have to see that video. This is the most one of the popular one, how to prepare for AMC exam or MC, you know, frequently asked questions. Student Medical Council frequently see is very high view count. If you want to see PLAB one, you can also see another my teacher. So she also done a video with the PLAB one with us. So that's like, these two are very highly viewed videos actually. Yeah. So this one is mandatory for you to see, to understand the process and more details things on. on that actually. Today's the early segment we'll also like to post. Now we can also see one thing that what other else type of things you can search in my YouTube actually, that is something you can type in that way, like work placements assessment. See, when I type that one, automatically it came, yeah, my video. So I typed workplace based assessment and just write the share. So in YouTube, when you type something, please use my word share. It will come very easily in that way. So workplace based assessment details video is given there. Now, if you also type AMC part 2, and if you type Shahriar Ahmed, you will also find relevant to that actually. If you want to know about AMC part 2, you can also see and go in that way, as I said. Yeah, and you can also go to videos. There's an option some people don't understand. People just enter into home, so they don't always understand. So say post-graduation Australia, courses to get PR in Australia, how to secure a job in Australia. All right, so there's few things, workplace-based assessment. Yeah. All right, so here's information's given, but the best way, if you click the videos, then it will show you everything. You see some recall classes, and this is a popular one. What to do after MC1. Now, up to the level I give you a knowledge right now, the superficial, this is a continuation of that one. So if you want to know a little bit more details about everything, what to do after MC1, this is a whole C 1 hour, 35 minutes. So certainly much more details brief is given there. All right. All right. Now, guys, please do not, like, Dr. Hafsa, do not talk about any third party things in our chat option. We'll red flag you next time. If you talk about, like, any things like that, we'll red flag you from the batch next time. Okay. So this is not a place like, you marketing something. Actually, if you're a scammer, I don't know who are you. I mean, it's difficult to understand if you're a student already or not. Yeah. So that's like, not appreciated in open class, doing things like that. Okay. And you need to please report me, for this behavior. Okay. Next is, like, if you can see what to do after MC1. Secondly, if you want to know about visa, this is another thing, useful. MC clinical session, John Mutta Gate, first look. Yeah, this is, I think I have shared in the group, like, so guys, this is another information. Um, we do overviews on the Friday. So it's like a small, like a 10-minute recording, what I'm going to do in the next week, that we upload in the Friday. So that's not a live session, but live sessions are Sunday and Thursday. So this is that video already shared in the group, I think, but you can check it actually. Yes. So you will find a lot of other, I think, some collaboration video I did with, like, other different type of exams and the things. So there's so many. You'll find it's an interesting one. What are the, because I used to also get question like this, like what type of bankers are accepted for MC fees. Okay, so that's another interesting. Okay, so if someone is from Bangladesh, you can also prepare, like, uh, this preparation video in Bangla, so you can also check it. This is a good one, like, a clinical gap for doctors. Now, some of you might be joining us and you probably have gap. Now, this is the explanation of that gap, actually, what to do. If you have gap, the basic is, if it is more than 3 years, you need to cover it. I repeat, if you have gap more than 3 years staying in Australia, you need to cover it later by going to your home country, probably a 3 months minimum. Every 1 year equals to like a 1 month. Okay, every 1 year is equals to like a 1 month coverage. Okay, some other day we'll also talk about observership in Australia. Actually, now it's not the time. Yeah. Okay, so some few things necessary. This is a good one. What are the necessary documents to bring to the exam hall? Actually, some people also used to text me by panicking. We can understand. So these are the basic things you need to take with you. Actually, yeah, I shoot that one from my office. If you will find seminar videos and the thing, a lot of medicals have been through. for seminar and things like that. All right. This is one of our Dr. Veronica. She managed her job and also update that, how she manages after part 1 might be interesting for you. Also a few about AMC2 and things like that. Yeah. So anyways, like hopefully things would be useful. Uh, Very interestingly, sometimes we also, because see, people don't share much information. A lot of dental doctors, they also left over. So a lot of requests as to guys, like you do a lot of things with the, as I said, I'm not from a dental background. I cannot do anything. Literally search a person, who passed actually dental exam in Australia. So if you know, or any one of your partner is from dental or friend, maybe this video can help them actually technically. I personally don't deal with any dental exam or anything. Okay, but that might be useful for some people actually. All right. So anyways, yeah, this is a good one for Plav info. I made so many one actually, that related and things. Yeah, mark distribution of MC. This is that mark distribution video. This is a place like how MC part 2 center looks like. I shoot that one while I had examined things. Yes. All right. And then some old videos like, I used to do hip hop at some time. I post one actually initial days. Anyways, that's like a fun. I mean, that's like a YouTube. So see, I mean, some of you subscribed, I think. So it's just jumped into point 1 looks like quickly. Thank you so much for that actually. Hope you find that helpful so far what I was just telling. So I'll keep a copy now and we'll get into our ECG section after 2 minutes. I hope those of you outsider attending the session so far is useful for you guys actually. All right. Yes, John Murtag again, 8th edition. Usually copy versions available in Asian countries. If you're in Australia, you have to buy the original version. Actually, you don't have choice. It's kind of like, I think, 130, 140 Australian dollar, I think, original book. Okay. But copy is also fine, actually. Yes. All right. So thank you so much. See, if you're attending the course, you probably don't need anything that I can tell you actually. We'll guide you and provide you everything. No need to worry.